warmly welcome you, Maggie, to our conference.
Thank you, Fiona, and thank you sincerely for this invitation. As you said, I'm the new Nursing and Midwifery Policy Advisor. And this has started as of August 30th, my new position. So I'm really, really touched by the invitations this month. They're very special, they're memorable. I think they will be from now on, but this particular first month on the job as Nursing and Midwifery Policy Advisor is very special. And I'm very, very humbled and happy to share an afternoon with you. So I was going to just share a little bit about, I was going to start my presentation by really talking about why this is such an unprecedented time, not just for Margrieta Langins, but for nurses globally. And what are the findings that are really driving the global health agendas and the nursing agendas, but also the European agenda, because I work at the European office, which is one of 6 regional offices to WHO. So I thought I'd go into that and then share some of the activities that we've been doing. So I'm going to share my slides, and that seems to be possible. Is that visible? I hope it is. Yes. So really, yes, the point is that it is an unprecedented time, starting with the Year of the Nurse and Midwife in 2020, which really ramped up the attention for towards nurses and midwives. And that was really with the help of many actors, but also at the WHO, Tedros's commitment was really essential to bringing a focused lens on nurses and midwives. But we were hit by COVID, and following that, we really saw how much nurses and midwives were able to step into really vital roles to keep our communities safe, but also how vulnerable and precarious our workforce is. These are things that we probably as nurses know very well, but it was an important way, an important time to really amplify those cracks. And I think that there's never been more attention on this than there is now. It collided with the World Health Assembly that launched the Global Strategic Directions on Nursing and Midwifery, which are, there have been a number of global strategic directions on nursing and midwifery, but now we have a new set, and we had our first WHA resolution after 10 years. So there had been a bit of a hiatus and a bit of inaction in this area. And so the global strategic directions on nursing and midwifery that were accompanied by the World Health Assembly's resolution, again, brought sharp focus, all happening then in the Year of the Health and Care Workforce, which I think was very much inspired by the Year of the Nurse and Midwife. And whilst it is the health and care workforce, I think it is not lost on anyone that it's an important year to not forget and keep focused on the nurses and midwives. So that Year of the Nurse and Midwife also was marked by a really big triad meeting. Because we were in COVID mode and because we went virtual, there was an unprecedented amount of participants at the triad meeting that happened in June of 2020. And that was followed by the World's Midwifery Report that, again, sorry, I should have started with the State of the World's Nursing Report, the first ever, that was the first attempt to really start collecting information about nursing and midwifery, despite all its cracks and shortcomings. But then followed by the World's Midwifery Report, which reminded us, which still is not as complete as we would like it to be, especially for the European region, and only sort of raises the importance of us getting better at capturing what nurses do, where they are, what they're doing. So I wanted to just talk about a few of the things that came out of the State of the World's Nursing Report and why this was so important for, or what are some of the key messages that are framing our international agenda. So one of the main bits coming out of the State of the World's Nursing Report is just how many nurses there are, but how great of a shortage there is still, and also what proportion of health workers they make up. Now, it did say that for our European region, which I'll later explain includes more than just the EU, that our sort of ratios were very good and satisfactory, but it wasn't able to tell us, we simply didn't have the data to show us where nurses and midwives are actually working, and that there are major disparities where they're working, whether it be geographical disparities within a country or whether it be within focus areas of practice. It also conflated a lot of different types of nurses. Another thing that the State of the World's Nursing Report raised were the programs. It showed that there are 5-year programs, but predominantly we are looking at 3 to 4-year programs. But in the European region, again, there is some skepticism about whether this is all at the level of bachelor's education. And so this was really challenged by the report, and this has become a real priority in our WHO region. It showed what we know, that nurses are predominantly female, but it also started to unpack how many of those female professionals that make up such a large proportion of our nursing workforce are actually in leadership positions, and how much education curriculums are integrating leadership training and opportunities for this to be on the horizon of our new nurses. And finally, another message that is really important to us in the European region is that the report reported a high level of government chief nurses in our region. Now, as understood by WHO, this is not always accurate. 86% was reported by our countries, but these included focal points that don't necessarily have the political status, as for instance, your chief nursing officer has in Ireland, to really converse and talk with the highest level of decision-making about the nursing issues facing the profession, about the issues facing the nursing profession. And actually here the point is that, yes, leadership programs are not in place early enough in our education systems for nurses to really carve out career pathways that both at the clinical level and the political level allow nurses to be in leadership positions. So the State of the World's Nursing Report, despite how perfect or imperfect it was a really important moment to have broad engagement on these issues, to collect data and to start dialogue. And for WHO, it really helps us and assists us in having conversations with governments when we are discussing decision-making and policy action around the nursing and midwifery workforce. And we really rely on associations to give that critical view of what they see in that data. You will know that the State of the World's Nursing Report generates these country profiles. And one of your members, Steve Pitkin, is involved in the European Forum for National Nursing and Midwifery Associations that is going to work closely with us to really bring a reality check to these State of the World Nursing country reports. I now just wanted to reflect on the global strategic directions on nursing and midwifery. As I said, there have been several. They've been successfully developed since 2002, and they really help ensure a focus on specific issues that can ensure midwives and nurses are optimally contributing to achieving population health goals. And it also helps us leverage and summarize the evidence from State of the World Nursing Report and the Midwifery Report, but also develop our normative work in the organization globally, but also at the European level. It provides some best practice, and it really, and what we're trying to do more and more is to really take a health labor market perspective. So that means while keeping focus on nurses, making sure that it's understood within the broader health workforce planning, and that it's understood over the course of the health professionals or the nursing professionals life course, that there are several ways of strengthening nursing. They have to happen continuously and in a coordinated manner all along a nurse's career. So just a little bit about the WHO Regional Office for Europe. We are not limited to 53 member states. And what makes our region really dynamic and really important, I think, is that we actually span all the way as far east as Israel and Tajikistan is a member state. This is 17 time zones, 4 official WHO languages within our region. And really, a very diverse group of countries with nursing, the nursing profession at various levels. And with all the sort of challenges that I imagine you're discussing as a nursing association in Ireland, I do have to say, I mean, there's a lot of challenges that are common, but there's also a lot of achievements that you as a country have achieved thanks to associations like you. And as mentioned at the starting, we have had the new development of me being in this new nursing and midwifery policy advisor role. And I think this is absolutely critical to have a nurse leading a nursing midwifery program to really keep tabs and keep charge of the activities that we do with member states and keep continuity of that conversation with member states, but also within our organization. I have a lot of teaching now to do, and I have the mandate to do that. And I have it from from our regional director, Hans Kluge, who is a very big fan of nurses and midwives. So I'm really, really grateful that he responded to the call from the ICN and European Forum for National Nursing and Midwifery Associations to appoint a nursing and midwifery policy advisor, and I'm extremely humbled to have this role. Now, what I will be doing in the next few years is still to be carved out and still to be worked through, but I do want to share with you sort of the mandate that Hans has given me. And this is the mandate of the European Programme of Work, which I have projected here, that these are the 3 priority areas for the European Programme of Work. They tie closely with the 3 triple billion goals that Tedros has set forward. But these are 3 major goals that the Ministers of Health have agreed to work with Hans on. And nurses are critical to delivering on this. So first of all, it's the moving towards universal health coverage and really ensuring we have people-centered services, financially protecting our populations, that citizens can expect access to care no matter where they are. And now, of course, in the light of the pandemic, the second priority area really is that in tandem with that, we are never letting our eyes off of the potential emergencies that can arise like COVID. There will be more, and to be really better prepared to respond promptly. And finally, to meet the expectations to live in healthy communities. There are 4 flagship initiatives of the WHO European region. They are the Mental Health Coalition that was just launched yesterday with the Queen of Belgium. Hans Kluge was launching that, and that's really a coalition to change the attitudes and mental health systems that we have in place to provide mental health services. Empowerment through digital health, renewing our commitment to disease prevention through the European Immunization Agenda for 2030. And the 4th flagship initiative is called Healthier Behaviors, incorporating behavioral and cultural insights. So really fostering healthy actions for life. And this is a very cross-sectoral effort. Now, just to give you an example of how my colleagues in primary healthcare are interpreting the 4 platforms. So my colleagues in the primary healthcare program are interpreting that at the primary healthcare level, we need to deliver on the mental health priorities by integrating mental health into the models of primary healthcare and system reorganizations, or to address vaccine hesitancy with PHC-based risk communication. And I can go on with the digital health and behavioral insights. But as a nurse, and as nurses listening to this, I think you can very clearly see that this is where nursing can be extreme, that has been working, that we've been working in these areas, and that we are essential to making this happen. And I think we really need to be better talking about that. So I'm all for the global strategic directions, and we cannot lose sight of the 4 priority areas for global strategic directions, but we cannot talk about them in isolation from these service needs. And we need to frame our advocacy for the role of nursing and midwifery in terms of how it benefits patients. How does it benefit mental health? How does it benefit an immunized population and so forth? So a little bit of an overview of the WHO European priorities in the immediate. So first, in March, I convened, and some of you were there, the strategy, the regional roadmap. We started carving out a regional roadmap for translating what the global strategic directions on nursing and midwifery are advising towards the delivery of our triple billion goals in the European program of work. So really tailoring our roadmap so that we can achieve those 4 priorities vis-a-vis the 3 areas that I've been asked to really focus on is primary healthcare, long-term care, and mental health. I will continue to do country support and strengthening nursing and midwifery. But at this time, one of my most important activities in the last month, and really for the next 6 months, is really building and strengthening my networks. Because there's a lot of resources out there. There's no point in of creating new stuff when we have so much good information out there and so much good leadership and so many good experiences. So one of the first things I've done, and that happened yesterday, is mobilize a training network, mobilizing and training a network of government chief nursing and midwifery officers. So we usually met with them every 2 years. We're now meeting with them monthly, and that started yesterday. I'm working very closely with the European Forum for National Nursing and Midwifery Associations and other relevant stakeholders like collaborating centers and academic institutions. But my connection with the INMO is invaluable. This is my inroad to hearing what the associations are tackling and dealing with in their countries. In the immediate sense, I'm also working at some work with Hans Kluge on attracting young people into the nursing and midwifery profession and really addressing acute attrition from the profession. So working together with Hans and my regional advisor, Thomas Zapata, on strengthening our resources for mental health supports and a campaign that really attracts young nurses to the profession. We're also working with our gender team and our socioeconomic team on shifting the narrative around the value of care and the value for nursing and midwifery, and start talking about the gender gaps that exist in our economies and in our health sector. And where we see that most is amongst the nursing and midwifery professions. And finally, translating evidence for key policy questions. So this is really important. As you know, there's a lot of evidence. There's an enormous nursing and midwifery research capacity, but we need to translate that evidence and answer and use it and tailor it to answer key policy questions that I'm getting asked by ministers of health or their deputies on how to strengthen nursing and midwifery, and really bridging the gap from evidence to research. So we have just a little bit on the roadmap, and then I think I've probably already spoken too long, but we have the regional roadmap that we started in March. We also have country examples. We have up to 40 plus coming in the different areas on global strategic directions on nursing and midwifery. We have a really great set of stakeholders working with us on it. We will be doing some consultations over the next month with our GC&MOs. We've already consulted with INMO and also with some of our experts. We are making sure it's aligned with national health priorities, and it has its own regional indicators. So we're trying to improve the indicator collection, the indicator database that's been used by our headquarters team with some regional indicators that we think are relevant. So here's just some examples of the case studies, but yes, we have, I believe, I believe we're still waiting on some case studies from Ireland. So I was asked by my colleague to prompt this team if there are any case studies that they can provide either in the area of service delivery, education or leadership, or jobs for our roadmap. So I'll leave that to you. But essentially we're launching this roadmap on December 10th with some special guests. This falls in line with the Universal Health Coverage Day. And just before that, we will have the end of the year of health and care worker, which I'm very involved in as well. And so we will make sure that there is nursing and midwifery activity profiled during that year-end event on December 9th. So with that, I am going to say thank you very much for this invitation. And yeah, if there are any questions or if there are any comments, I'd love to hear them.
Thank you so much, Maggie, for that. We have a few questions. One of the questions just was asking, is there any strategies that we need to consider to overcome the shortage of nurses and midwives?
Are there any strategies? I mean, I was just with the Nordic Nursing Federation, and they have a wonderful policy piece about the importance of chief nursing officers, and some of those countries are really fighting to get a chief nursing officer in place. My feedback to them, I know you have a chief nursing officer, but it was very much in line with what I just said, which is they were very good at articulating why the chief nursing officer helps advance regulation, helps advance education, helps advance job security, but they weren't able to frame it in terms of, and this benefits the patient for mental health issues, I mean, or long-term care, or they weren't able to speak as clearly to the health needs and the health and frame it as patient outcomes. And I do think that that's a strategy that every association, and I get that a lot. I've gotten that from the East. How do we make it more, how do we get nurses to be more powerful and to be at the decision-making table? And my answer always is like, did you pitch it as a sort of existing patient health need, right? Did you frame it as what is some sort of actual health challenge in your society? So one of the things that is really prevalent from COVID is all the socioeconomic inequality. We've had enormous inequality, and I don't think Ireland is exempt from that. And the role of nurses in contributing to that is enormous. And there's this new WISH report, right, that our colleagues in Northern Ireland have worked on that we're going to amplify, because that's responding to a Minister of Health's need to tackle this. And within all of that, we can embed the global strategic directions on nursing and midwifery. So when we do launch the global strategic direction, the roadmap for our global strategic directions on nursing and midwifery, we're really going to make sure that it's sort of fronted by an actual health priority that countries are facing. And that's going to be social inequalities this year, but I think that's how we have to approach it. And so I invite you to do the same. I hope that's helpful.
That's lovely. Thank you very much, Maggie, for your very informative conversation with us today. And we look forward to working with you.